That was the Stylistics. People make the world go round. Dr. Doug here with the Cure VF and the Heart and Soul of San Antonio. And we had a great day today. It's not over just yet. We had Wednesday Baldwin. Remember, she's got that concert going on tonight. This concert you don't want to miss. Her first solo concert, and she is going to do a wonderful job. Plan on making it over there myself. And thanks, Wednesday, once again for being on the show today and for being the person that you are. We love you. We love you. We love you. Keep up the great work, as I know you will. I wasn't going to do a conversation today, but I changed my mind because I had three things I wanted to talk about, and they're all important. But the other two can wait because, as we've talked about before, politics are local, and so we got a local thing I want to discuss today. I've only got 15 minutes on the clock since I used up part of my time for Wednesday, so I'm going to be able to go over this not in the level of detail that I'd like to, but if you want to find out more about it, read my article that's going to be on next Wednesday's San Antonio Observer. You can get the San Antonio Observer all over the city, especially on the east side, local markets, places like that. But you'll be able to find it. So today we're going to talk about paid sick leave. Now paid sick leave. It's been an issue here in San Antonio for years and years and years. The Texas Organizing Project and among others, Move On Texas and several others have worked long and hard. Neighborhood First Alliance, and you can go on and on and on. Have worked long and hard to make paid sick leave a reality here in San Antonio. So in 2018, it finally happened. They tried to do everything they could to block it, to keep it off, and finally, because of all of these grassroots organizations, they were able to get together enough signatures to get it on the ballot. It won overwhelmingly. And then that's when the hard work started because one thing about Texas, it's a great state to live in, especially if you're an entrepreneur. If you got something you can do, you got a great idea, it's a great place to be because, there aren't a whole lot of rules and regulations, pardon me there, a whole lot of rules and regulations that keep you from doing the things that you want to do. And you can open up a business, you can make good money, and you can be your own boss. And it's a lot more difficult to do that in other states than it is in Texas. So Texas, while it has a lot of its colloquialisms, um, you know, that it's going to be a conservative red state is one thing. And I'm not here to talk about red state, blue state, that kind of stuff. It's not what the conversation is about. But I will tell you this. The way that Texas does things, and they have done things for quite some time, it's one of the reasons that it's one of the more prosperous states in the country because they're pretty conservative, and pretty much they try to be fair, but they try not to be overly costly in the way that they hand out um, um, things for the public good. So that's caused because Texas has a lot of nonprofit organizations, and there are a lot of people who give to those organizations, and those organizations thrive because people give to them. And that's the generosity of the populace of Texas, not necessarily the politics, but the populace. So I tell you all that, getting down back to paid sick leave. One of the things is that there are, like in every other state, Texas is a state of haves and have nots, but because of cost of living in most of the places in Texas, the have nots aren't as really oppressed as they are in some other places. But one thing for sure, people are underpaid here, and people are undereducated, in my opinion. And the stats show that. And one thing, people are not necessarily treated the way that they should be treated by many employers. And Texas knows that by and large, if they get something that goes against what those in power that goes against what the wishes of those in power, they know that they can get, they being those in power, they know they can get enough people to go vote to overturn something in the legislature or however they do it. That's been the way things have gone for a long time. So paid sick leave, we got paid sick leave passed here in Texas. It also got in San Antonio, and it also got passed in Austin. But in Austin, it was turned down because some judge, kind of tore it down, and that was it. But in San Antonio, we were able to go through and all the injunctions and everything else, and we were able to go. So it was supposed to take place back in February, but it didn't. And there was some kind of a waiting period. So it was supposed to take place in August. Then there was another injunction, and so it just got heard just last week by one of my favorite judges, Peter Sakai. He's a great guy. He does a lot of stuff with the children's court and everything else. I was really surprised when we got. I was actually happy when we got him to see the case, to try the case, hear the case. But I was really disappointed in his ruling. But that's neither there, and everything can't go your way. But those who filed the civil suit against the city of San Antonio for the paid sick leave, they claim that paid sick leave is a wage, and that it affects things. It's like it's like the city or the state assigning a wage, and they can't do that. That's got to be something that's done through the legislature, so to speak. So anyway, that's their ruling. But one of the things, though, here's the fact. The fact is, wages have stagnated. Racial disparities are continuing to grow. Housing prices are soaring all across the country, especially here in San Antonio. Even though the mayor's going to be on here on the 7th, and they're trying to do things to address the housing issue. But so I don't want to go all out and everything, and everything as gloom and doom. But it is what it is. And so you get nonprofits, you get civil rights groups like the Neighbors First Alliance, the Texas Organized Project, Move on Texas. They try to do things to get things adopted and put in place that will reduce the inequities and improve access to economic opportunities for the average person. And that's what they do. And they do a great job. They really, really do. And this whole paid sick leave thing, more and more states are adopting it, actually. And what paid sick leaves do, basically, it permits workers to take time to recover from an illness or care for a sick family member, which can improve public health by slowing the spread of contagious illnesses, provide economic security for workers and their families. Many public health officials, even those here in Texas and in San Antonio specifically, advise workers and students to remain at home when suffering from contagious illnesses, like the flu, for instance. But low income and otherwise economically insecure workers may lose pay when they miss work because they or a family member becomes sick. When the workers attend work while suffering from an illness because of lack of paid sick time, they risk reducing their on-job performance, entering or worsening their illness, or spreading their illness to customers, coworkers, and others. And so, with the paid sick leave days, they address those issues by requiring employers to allow workers to accrue sick time at a specified rate to be used for various reasons, including allowing workers to accrue to recover from their own illness, access preventive care, or providing care to a sick family member. Now, the first place this was passed was in San Francisco, and so that was in 2007. Since 2007, paid sick days have been adopted in 11 states, the District of Columbia, and more than 30 cities. So, and what's happened is there have been a lot of studies, but the people, the businesses that are against paid sick leave, they don't want to talk facts. They want to talk folklore. They these people that they hire and whom they trust, all of a sudden now, as their defense, they say if you give people paid sick time, they're going to take it whether they're sick or not. And there might be some rhyme or reason to that, but by and large, everyone gets sick. By and large, everyone ends up having to go to the emergency room. It just causes problems. The illness gets passed around the house. It gets passed around the office. It gets it is a problem. And so paid sick leave is important, and it's really kind of like the dark ages. The fact that the populace in places like San Antonio, like Texas, doesn't read enough to refute the crap that people throw at us when it comes down to talking about an issue as important as paid sick leave. Now, several studies have been done. Those studies found that employer implementation was not overly burdensome. Access to paid sick days lowers rates of presenteeism. For those of you who've never heard that term, presenteeism is the phenomenon of attending work while sick. Now, the literature is the health benefits is the positive health benefits of paid sick days overwhelmingly is in favor of paid sick days. I mean, the positive health benefits overwhelmingly supports paid sick days. And I said that twice in a row. And it results in less emergency department usage and increased preventative care. You know why the preventative care thing is important? Because now people don't have to forego their physicals because they can't get off work. So people say, I got to get my physical, I got to go get my lab work done, I got to get whatever I have to get done. Well, many employers we don't pay for that. Well, then you go to your private physician and they say, hey, dude, the office closes at 5:30. Well, I don't get off work till 5:45, or I get off at 5, but it takes me an hour and a half to get there, or whatever. You can't get a couple hours off to go get a physical, whatever. And because you don't, then things happen to you and they fester and they get worse. And by the time you go to the emergency room, you're getting put hospitalized because you never got it taken care of. So preventative care is just as important of taking care of yourself when you're sick. So here, Connecticut was the first state to enact the paid sick day legislation of the entire state of Connecticut. And that was in 2012. The Connecticut law mandated that firms with 50 or more employees offer paid sick time to service workers. The San Francisco policy included no such exemption based on the size. So one of the things here about San Antonio, they've got the big businesses. They really, 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 they do a good job here in San Antonio. What they do is they come up with the fear tactics, and then they get the small business people to agree with them because they go to some of these little, chamber meetings or whatever, and they tell the small business guys, hey, if they enact paid sick time, all of you guys are going to go out of business. I mean, we've seen that in the Express News. They have all these farcical comic things or memes about businesses going out of places going out of business because they've got paid sick leave. That stuff is not true. It could be further from the truth, and the studies don't support it. Places where they have paid sick leave doesn't support it. Nothing supports it. It's just folklore, and they get you to. And you know why they do that? They do that because they don't want to pay. Now, if you got a company, you're a Fortune 250 company, you should be paying sick leave for your employees. You should be. But because these big corporations have gotten so cheap and so focused on their Wall Street numbers, they don't care about anything except their stock price. They could give a damn whether a person is sick or not, and they're not going to pay for you to be off. They don't want to pay for you to be off. So what they do is they come up with all these fake reasons, and they get the small business people to come up and pile on. And before you know it, you go in front of a person like Judge Sakai, and he goes, oh my God, there's a coalition. There are big businesses, small businesses, all these businesses are against this. I better have some type of injunction so we can study this further. Well, who's got money to study it? The big businesses do. And they're going to take those studies so that they support them. But I've got the real facts here. So, to say that. And, more and more states are doing this. Now, I do think that, many small businesses. Now, I know people who are small business owners who have less than 10 employees. I know small business owners who pay their employees when they're sick and who also give maternity leaves. You know what? They haven't gone bankrupt. Their profits are going through the roof because people, if you care for them, they'll care for you. That's a fact. That is a fact. So, but anyway, getting back to what I was about to say, 11 states, and what I was going to tell you is that this whole thing where in Connecticut, you have to be a company of an employer of more than 50 employees to offer paid sick time. I think that's a fair compromise because, if you got a barber shop or if you got a small, convenience store or bodega or something like that, it's kind of hard when you got 3 people and you get somebody time off. You got to pay them for the time off, and who do you get to stock the shelves? How do you get that done? How do you accrue that? I mean, you're maybe not big enough to get that cost done, and so we got to figure other ways to help those folks. And I think giving them access to some of the day job providers could help mitigate that, but we'd have to negotiate with them and kind of figure out who's going to pay them and how they're going to get paid and that kind of stuff. But I'm sure we could work something out if we put our heads to it. So, most paid sick leave laws stipulate that employees accrue 1 hour for every 30 hours worked. Some jurisdictions, they have a lower rate, like you get 1 hour for every 35 hours, some every 1 hour for every 50 hours. So it depends on the locale. So now 22 states have passed preemptive laws preventing localities from requiring workers to employers from providing paid sick time. These include 4 states that currently pass statewide laws that prohibit localities from establishing paid sick day requirements, and they differ from the state standards. So they're trying to do that in Texas. They're trying to say that local paid sick day laws passed in Texas, in Austin, in San Antonio specifically, they are a competitive disadvantage relative to businesses located in jurisdictions that do not require them. This is emblematic of the case for preemption in other states. Proponents of preemption in Texas also claim that the Austin ordinance disadvantages working families who require a dual income, live within the city limits, and employ caretakers for their children while at work. So, and that's just crazy. That's crazy. So, once again, they conducted the study. Now, this research that I'm referring to here, there were 23 studies done between 2010 and 2018. Of the 22 studies that were reviewed, um, uh, nine of them were self-published reports. I mean, they came from a company that actually uh, that studied itself. That's so pardon the phone in the background. Um, so, but anyway, 15 of the studies assessed the impacts of paid sick leave days on businesses and everything else. And they they came away overwhelmingly in favor of paid sick days. The companies that were studied, 15 of the companies, out of 23 studies, 15 of them showed that the companies actually increased productivity. The absenteeism went down. Presenteeism was, that's working while sick, was almost eliminated. And so it was actually great. So uh, there were two studies that focused solely on access to paid sick days, but they did not want to report on the impact. They just said the paid sick days cost a lot of money, but they didn't look at productivity, health, or anything else. They just said that they couldn't be done. So two of the studies were just kind of like had the results tainted in favor of no sick time. So anyway, 6%. So and the other thing is, the people who run these companies, they get paid when they're off sick, but the employees can't. So if it's good enough for the employer, why is it good enough for the employees? I never can figure that out. Um, Check it out here now. Today, according to this, 71% of private sector workers have access to paid sick days. That comes from the U.S. Bureau of Labor Statistics. But anyway, that still leaves about 35 million U.S. workers who cannot earn paid sick time to recover from illnesses, care for sick family members, etc. And these disparities persist among workers regardless of access to sick time based on race, ethnicity, occupation, supervisory status, and annual earnings. So, they're saying here that the lower paid workers and the minority workers and are the ones who need the most access to paid sick time, but they're the ones that least likely to get it. So, low income workers. So professional workers, people who get paid salaries, they have about 90% of them have access to paid sick time. Okay, according to these studies. Lower income workers, only about 30%, and hourly workers, only about 30% have access to fake. So you look at that. People are salaried. You got a college education. You make more money. You get paid sick time, even though you're salary. You get paid sick time. Low people who really need to pay sick time can't get it. That's a problem. That's a problem. And excuse me. um, In New York, 85% of the employers who were studied reported that the new paid sick time off law, did not affect their overall business costs, and less than 2% reported a decline in overall cost. So, 85%, and that was in New York. It's a big state, 47% of employers reported no increase in costs because of paid sick leave. So, it's over. In San Francisco, 71% report increased productivity. 71% of those studied. Seattle, no effect on profitability or productivity for paid sick leave. So you look at it. In all, okay. 94% of the employers in large cities found that paid sick time had no effect on productivity or cost or the bottom line. So, and it goes on and on and on. And, as far as workers, workers reveal they've had higher job satisfaction. These are people who take sick time. They have higher job satisfaction, appreciate the added protection and benefit, and generally feel better off even if they had paid sick time available to them before the mandate. So people are like, people feel like their employers are more supportive of taking sick time, higher job satisfaction. 84 reported that employers are more supportive of talking about or of taking sick time. They want you to take sick time. 72% reported higher job satisfaction. That's in Seattle. So all over, the literature is growing on the health impacts of paid sick laws. Workers who lack paid sick time could defer or avoid preventive care, which we talked about earlier, lead to the need for medical care at later stages of disease progression, higher costs for workers, and the American healthcare system as a whole. One study found a sample of working adults aged 18 to 64 without paid sick time were significantly less likely to report having used 6 of 8 preventive health services in the past 12 months. So, people just don't go to the doctor. Why? Because they can't afford it. So, this whole thing about all of these things that people say about the paid sick leave, it's all folklore. It's all lies, and nobody wants to talk about facts. And I want to talk about a little bit of facts. Apologize for rushing this today, but I didn't want to get this out because it is important. I wanted people to understand, and I'm going to write about it in the Observer. So get the Observer next Wednesday. You can read the article. I'll be in more detail. It'll be a little more succinct and less disjointed than that was, but I had to try to put it together at the last minute because I wanted to make sure that I got something out about paid sick time. Anyway, that was funny. My boss calling me, telling me I would talk too much. So Dr. Doug here with the Killer VFM, the Heart and Soul of San Antonio. Appreciate those of you who are listening, and hopefully it was helpful for you. Right now, a little bit of more Norman Brown, what's going on, and after that, we'll be on our way out of here. But thanks so much for listening today. Hey, thanks for Wednesday Ball. I really appreciate Wednesday Ball. And her, good luck tonight. I'm going to see you there tonight. Here on Monday, we got a turkey giveaway. Monday, the November 25th, turkey giveaway from 9 to 12 at the Barbara Jordan Community Center, sponsored by the Black Police Officers Association. So that's going to go on. There's a toy drive that's going to be at the Carver on the 14th. Make sure you go and do that. Dr. Doug here with you, checking out for tonight. I'll see you guys next week. Thanks for listening. What's up, Tim? See you out there.